Everyone has been affected by cancer in some way. Of course, it's scary when a family member or friend is diagnosed, and some always ask, what can they do to help? Well, we have a suggestion. Susan Crutchfield from the USA Health Mitchell Cancer Institute here with us to tell us about a unique volunteer program. Thank you for joining us.
Oh, thanks, Lee, for having me. I appreciate it so much.
Volunteers, you guys are always needing them, but specifically right now there is a great need.
Well, we are, and we do have a volunteer program that actually there are several ways that you can volunteer. You know, we have something called Alabama Hope Volunteers. Those are for cancer survivors and that do education in the community. We have volunteers who might help with an event or something like that, but specifically what I oversee are volunteers that are in our infusion suite.
You guys have a lot of patients that come in there daily. They need a range of things, and volunteers really play a unique role.
They do. They really are just there for comfort measures. You know, doing things like getting coffee for a patient, getting a blanket, you know, when you're hooked up to an IV pole, receiving chemotherapy or immunotherapy, a lot of times your mobility is limited, and so you're there to provide comfort measures for the patient.
What's a typical day like for a volunteer when they get to the Cancer Institute? So
when they arrive, we do 2 shifts. We usually do a morning shift that's like 9 to 12 or 12 to 3, and when they come in, they usually just check on things like coffee, like snacks for patients, you know, and then they help to restock things because the nurses sometimes have completely depleted blankets by, you know, an early time. And certainly we have medical assistants that do things, but just the volume of patients that we have now, it's just so wonderful to have volunteers. And we were actually spoiled pre-COVID times by having a very robust group of volunteers who had been with us for a number of years. And we just haven't gotten back there with COVID.
Yeah, so the pandemic definitely hit you guys there as well. And this summer,
absolutely.
You guys kind of got back to normal. Tell me about that.
Well, we had to, you know, we had to completely shut down any volunteerism whatsoever, you know, when the pandemic was going on. And so we brought it back just a little bit of a time, making sure that we were going to be safe. This summer, we actually benefited from we got a few volunteers back, especially in Mobile. We had quite a few that came back in Fairhope, which was wonderful. This summer, we actually had a lot of our students who came in, and that was wonderful to have them because they sort of made up the difference there, that we didn't have quite as many of our regular volunteers there, but the summer students were here.
Definitely a rewarding experience, and they can volunteer on both sides of the bay. If someone is listening to this right now and they're interested, how can they get in touch with you guys?
Absolutely. They can just go to a website, look for the USA Mitchell Cancer Institute or USA Health, and go under Cancer Care. And in the upper right-hand corner, it actually doesn't sound exactly like what it should be, but you click on Your Visit, and when you see it, you'll automatically see it. It's in the right-hand column, about the 3rd click down, and you can fill out an application right there to do it, and I'll be glad to contact you, or it will have my phone number there that you can certainly call me at the Cancer Center.
Sounds good. Sounds like a lot of people go to great lengths to make sure these patients are very comfortable.
You know what they do, and as much as anything, it's just the you work on a regular day. You select a certain day that you volunteer, and they get to know those patients, and you'll have a repeat. They just enjoy coming in and seeing your face, that you're always there, and it's like you're my caregiver. And so it's just that extra person. And even from the perspective of the caregivers, you have people who are just excited about seeing that regular volunteer there for them. It's almost like a friendship.
All right. Thank you so much, Susan, for joining us again today.
Thank you for having me. I appreciate it so much.